We've seen this report that there's an internal memo circulating in the State Department. Some of these people who may have come down with Ebola in Liberia or Guinea or Sierra Leone may be brought to the United States for treatment. Is that true?
Not at all. Not at all. We are not considering bringing non-Americans to the U.S. who have Ebola to be treated. This memo that you're talking about is an internal draft from weeks ago, was never cleared by anyone at a senior level, was written by a mid-level staffer, and is just has no basis in what we're actually going to be doing. We have no plans to do this, period.
What would be wrong, though, if you get somebody from Britain or France or some other volunteer doctor or nurse over there who's got Ebola and needs U.S. help? What would be wrong with bringing them to NIH or Emory University Hospital? There's something wrong with that?
Well, in practice, obviously, the reason the memo was written at that time, again, several weeks ago, was that this was when some Western European countries were in discussions with us about what would happen if, as you said, one of their health workers were to get sick. That's why the memo was written. You're right. If someone gets sick and needs treatment, we should look at all of the options. But to be very clear, at this point, we do not have plans to bring non-Americans to the U.S. for treatment. Could not be more clear than that.
Is Russia trying to hack the the computer system over at the White House?
Well, I know my White House colleague spoke to that today. We know there are a number of actors who are looking to see if they can penetrate our systems here. When there are activities of concern that are seen on the systems, obviously people look into them and try to mitigate.
Would that be a violation of it? We know that the U.S. spies on Russia, the Russians spy on the United States. I assume this kind of stuff goes on all the time.
Well, I wouldn't assume that this kind of stuff goes on all the time. But look, if we know people are trying to get into our systems and we don't think it's acceptable, we have our systems protected for a reason. If we see concerning activities, we'll address it.